Welcome to the Million Hearts Model's next video, Driving Patient Behavior Change. As an intervention group participant, you know that much of the success of any cardiovascular intervention is dependent on your patient changing their behavior. For example, quitting smoking, changing their diet, or taking a new medication. To help you be successful in preventing heart attacks and strokes among your high-risk population, this video covers a few tips and methods for driving patient behavior change. Meet Dr. Peterson and Dr. Johnson, two providers who work at a Million Hearts intervention group organization called General Family Health. Now that General Family Health has begun enrolling and risk stratifying model beneficiaries, Doctors Peterson and Johnson are thinking strategically about how to drive sustainable behavior change among their high-risk patients.
We've been curious to know what other organizations are doing to help their patients effectively change behaviors contributing to their risk of having a heart attack.
Dr. George Matthew of Pacific Family and Internal Medicine, another intervention group practice, has several recommendations for helping patients feel not only comfortable with, but optimistic and confident about adjusting their behavior. Let's discuss a few. Clearly display and define the patient's risk score in the visit. Clarify that the risk score represents the patient's risk of a debilitating and quite often disabling stroke and/or heart attack, leading to loss of independence as a result of CVDs in the next 10 years. It can be scary, but it is incredibly effective. Dynamically evaluate treatment options with the patient. Use the treatment planning page in the MHM data registry in real time to select therapy choices and explain which one will have the strongest impact on the patient's projected risk score. Make sure to thoroughly explain the risks and benefits of the selected therapy. Empower the patient as an agent of change. Emphasize to the patient that one behavior change, like smoking cessation or starting statin, can have a significant impact on their life expectancy. They can change their own life.
I like these ideas. Dr. Peterson and I find that oftentimes we only have 5 minutes with a given patient, making it difficult to get deep with the patient on exactly how they will start exercising or exactly how they will approach quitting smoking. When a patient leaves the office, how do we know they have what they need to be successful?
Samantha Totoro Quinn, a population care coordinator at another intervention group practice, Family Practice of Centrastate, faced a similar question. So Family Practice of Centrastate utilized their hospital system's Health Awareness Center with multiple nurse health coaches and a population health management team. The center leads a hypertension management program, smoking cessation program, and diabetes program. Centrastate's Health Awareness Center recently designed a 12-week pilot program aimed at improving blood pressures in patients with hypertension by ensuring patients are getting the attention, clarity, and follow-up needed to change their behaviors. The key goals of the pilot were to increase knowledge regarding hypertension risks and treatment, increase patient engagement and empowerment, achieve at least 75% compliance rate with home BP monitoring, increase patient self-management skills such as medication compliance, and ultimately improve blood pressure.
We have similar goals at General Family Health. How exactly did the Centrastate Health Awareness Center program work?
The Health Awareness Center selected 19 patients to participate, primarily through physician referral. Patients were 90% Caucasian, an even mix of genders, and an average age of 61. After patients concluded visits with their providers, Centrastate referred them to the center for an in-depth meeting or phone call at no additional cost to the patient. In follow-up meetings, health coaches had conversations with patients about their behavior change goals and helped connect them with the right community resources that might support those goals. For example, some gyms offer a short-term free trial membership which can help a high-risk patient get started on a new exercise routine. The program has already seen very positive results. CentraState found that it eased provider burden. The program linked the community to a primary care medical home. It increased the use of other supporting hospital system services. 68% of the participating patients remained engaged in the program throughout. 100% of the patients in the pilot now have blood pressure home monitors. The average blood pressure improved from 157/87 to 136/81, and 70% of the patients ended up below 140/90. This program, as well as many others offered by CentraState's Health Awareness Center, is now being utilized by the providers at family practice of CentraState to assist patients in reducing their CVD risk scores.
What a success! We'd love to do something similar, though we're not affiliated with a hospital system. Dr. Peterson, how do you think we could adapt this approach for general family health?
Well, the idea is to connect our patients with the services in our community that will support their behavior changes. We could assign staff within our own practice to be a health coach, even if it means just reviewing with the patient what was said in the visit. The assigned coach or another administrator should first find out which hospitals or hospital systems our patients use the most and explore which programs they offer. Most of the time, we will be able to find a number of free or inexpensive programs that can assist our patients with a specific element of their cardiovascular health. Within these hospitals or hospital systems, we can look for a health promotion center or a wellness center and ask what they can offer to our patients. We may find they offer programs specific to smoking cessation, diabetes prevention, weight loss, stress reduction, healthy eating, and more. Finally, we should investigate opportunities to refer our patients to these programs and solidify a system for receiving feedback from these programs on those patients we have referred so we can track their progress.
I love it. Let's give it a try.
Good luck, and thank you to Dr. Matthew and Samantha for their ideas on how to drive patient behavior change. Go ahead and reach out to them directly for more information on their lessons learned. And remember, these are just a few examples. We want to hear what is working for you too. Log onto MHM Connect to share your experiences with your peers. As always, thanks for your commitment to the Million Hearts model.